Public health has a long history, beginning with ancient civilizations like the Indus Valley, which built drainage systems, and the Greeks and Romans who emphasized clean water. During the Middle Ages, responses to epidemics such as the Black Death led to early public health measures like quarantine. The Renaissance and Enlightenment periods saw advancements in medical knowledge with figures like John Grant and Edward Jenner for epidemiology and vaccination.
In the 19th century, pioneers like Edwin Chadwick and John Snow played crucial roles in linking poor living conditions to disease, sparking major reform in public health. Their work highlighted the importance of sanitation and paved the way for significant improvements in living standards. The groundbreaking germ theory, proposed by Louis Pasteur and Robert Koch, revolutionized hygiene practices and disease prevention. This theory identified microorganisms as the cause of many diseases, leading to advancement in medical practices and development of effective sanitation measures that have saved countless lives.
Ancient civilizations. The Indus Valley Civilization around 2500 to 1500 BCE demonstrated early public health principles through the construction of sophisticated drainage systems and communal baths. These innovations were among the first known efforts to manage waste and maintain public hygiene that helped prevent the spread of diseases within densely populated areas. The Greeks and Romans developed aqueduct systems to supply clean water and constructing public baths and sewers. Their emphasis on hygiene and sanitation reflected an early recognition of the importance of clean water in preventing illness. During the Middle Ages, public health responses to epidemics like the Black Death around 1347 to 1351 included measures such as quarantine and isolation to control disease spread. These early public health interventions were based on community-wide strategies to limit contact between infected and healthy populations on a large scale. Widespread epidemics of infectious diseases such as cholera, smallpox, and tuberculosis have occurred in America and Europe, which claimed hundreds of thousands of lives. These outbreaks have led to John Grant's foundational work in epidemiology and Edward Jenner's development of the smallpox vaccine. Grant's analysis of mortality data helped understand disease patterns, while Jenner's vaccination method provided a practical tool for disease prevention. These contributions have shaped our modern public health today.
What is public health in modern times? Modern public health is about health promotion and preventive measures. Public health is affected by so many social factors and therefore should have a wider perspective. During the 20th century, based on the Center of Disease Control's 10 great public health achievements in the 20th century, these 10 are the most standard achievements with the World Health Organization. Vaccination. Vaccination to reduce rate of epidemic and pandemic diseases were introduced to prevent the increasing number of morbidity and mortality rate. Two of these resulted to the eradication of smallpox and widely known COVID-19. Improved vehicle safety. In the 20th century, given that there have been an increase in the travel distance, there has been 90% decrease in the annual death rate for motor vehicle. Interventions particularly involves safety belts, alcohol-impaired drivers, and many more. Reductions in prevalence of tobacco use. Smoking cessation, interventions, and regulation of selling and purchasing of tobacco resulted to the substantial decrease of number of smokers. Fluoridation of drinking water. The fluoridation of drinking water was introduced to reduce the dental caries of communities. Family planning. Family interventions were improved, which affected in longer intervals between births and smaller family sizes. Both are seen as an improvement in maternal and children's health. Control of infectious diseases. The leading cause of death are pneumonia, tuberculosis, diarrhea, and enteritis were decreased because of the implementation of sanitation and hygiene, vaccination, and antibiotics.